We are too good of a people to continue to be the worst state in the nation when it comes to health outcomes.
We're not doing well health-wise. Your life expectancy is lower than other states because of our health.
We need to do a better job of educating why health matters.
What we're talking about, honestly, is life and death consequences.
It's a complex problem. It's not going to be an easy solution, and one person isn't going to change it.
It takes all of us coming together to make us healthier. And I think we're making progress to take us from the bottom to the top.
State of Health, presented by Diagnostic Laboratory of Oklahoma. Choose to know through DLO.
The cost of health care and receiving quality care weighs heavy on the minds of Oklahoma families. And when you look at how Oklahoma stacks up against other states, our health is, quite frankly, poor. Good evening, I'm Kelly Ogle.
And I'm Amanda Taylor. Oklahoma's health crisis is hurting our families, our communities, and our state. So tonight we begin a deeper look into the state of health here at home. What options are out there for the millions of rural Oklahomans having to drive hours for quality care?
We'll help you navigate rising insurance premiums and find out what the state is doing to stop that trend.
Oklahomans are also fighting rising health care costs. We'll tell you how you can bargain to lower those bills.
And we'll show you some cities taking action to provide a healthier place to work, live, and play.
Oklahoma's health scorecard is filled with discouraging news. In fact, our state ranks almost last in overall national health.
And yet, many Oklahoma healthcare workers say there is reason to be optimistic that we can turn the tide. Terry Hood begins our coverage.
Dr. Colony Fugate was only a teenager herself when she found the inspiration upon which she built her career.
I saw a 7-year-old with obesity, but he had type 2 diabetes. And I just thought to myself, oh my goodness, what a challenge this child has in front of him.
Now she spends her days in Tulsa at Oklahoma State University's Center for Health Sciences, working to protect the youngest generation of Oklahomans from a similar fate. Obesity, she says, is a complex disease upon which a mountain of other chronic diseases are stacked, shortening lifespans and diminishing the quality of life for more than a third of Oklahomans.
Individuals who are overweight or obese are less likely to be as productive at work, have higher rates of absenteeism, tend to retire early. They also experience extreme levels of bias and stigma in the community.
Dr. Fugate's Family Health and Nutrition Clinic is dedicated to reversing the rising tide of obesity, and she points with pride to the small victories already won. The skyrocketing rate of childhood obesity has begun to level off in Oklahoma. Still, the state ranks 43rd in the nation, with 34% of its adults classified as obese. Other statistics are just as grim. Oklahoma is 48th for cardiovascular deaths, 48th for physical inactivity, 45th for smoking, 44th for cancer deaths, 42nd for diabetes. We're almost last for fruit consumption and not much better when it comes to vegetables, all of which puts us as number 46 for premature death and overall national health. It's an epidemic affecting not only our health, but our pocketbooks.
It's enormous, the cost, the financial cost.
And that's not just in healthcare expenses. In trying to recruit companies to Oklahoma, Governor Fallin found our poor health is actually costing us jobs.
And they actually said, I chose not to come to Oklahoma because you rank poor in health. And if you have unhealthy workers and unhealthy people, then my health insurance costs are going to be higher, plus people are going to be taking off work because they're just not healthy and they won't be as productive.
And yet, when Dr. Colony Fugate looks over her home state, she remains undaunted.
Oh no, I'm not discouraged by any means. There's a lot of really good work being done around the state. And I think we're making progress, honestly.
Her optimism is shared by the Dean of OSU's College of Osteopathic Medicine, Dr. Casey Schrum. Oklahoma's poor health outcomes are due in no small part to simply a lack of medical care. We're 48th in the nation for the number of physicians, and rural areas are especially hard hit.
They want to get care in their communities. It's hard for people to travel, miles and hours to get to some place to get health care.
But now, new technology called ECHO is extending the reach and the expertise of Oklahoma's university hospitals to every corner of the state.
It allows us to transfer the knowledge that we have to those communities, to physicians, to nurse practitioners, to community health workers. That's the kind of thing that we need in our state.
But to truly begin healing in Oklahoma, Dr. Schrum believes there is one more piece, the most important one, and that lies in the hands in each and every one of us.
True change happens when someone takes their responsibility for their own health outcomes. Our patients ultimately have to be accountable for their health and their health decisions.
Terry Hood, News 9.
How would you rank the quality of your health care? A News 9 poll shows many Oklahomans are split, with about 60% considering it just fair or poor. 35% say the quality is good or excellent. Making sure all Oklahomans have access to medical care is a big challenge for state leaders.
We're not talking about having health insurance, but just that there is a doctor or a hospital somewhere in the same county. News 9's Alex Cameron shows us, depending on where you live, that is definitely not a sure thing.
And how long has this been going on?
Oh, probably 4 or 5 days.
Ginger Daling is grateful for the medical care she gets in her hometown of Beaver.
We have amazing nurse practitioners here. We have had some young doctors, but they don't stay too long.
Right now in Beaver, in all of Beaver County, there is one practicing physician.
Yes, that's me.
Dr. Gary Matthews came here 7 years ago. He needed a job, and Beaver needed a doctor.
There's been a rapid turnover of doctors here.
Matthews is from the area, so he seems content to stay, which is great. But still, he's just one doctor working with 3 nurse practitioners, handling everything from ingrown toenails at the community clinic to major trauma at the ER across the street.
The emergency room puts a little pressure on all of us because we see all kinds of cases. Not a lot of them, but some very serious cases that none of us were really trained to handle.
Telemedicine helps, but only so much. More serious cases and any sort of surgery require transport.
You have someone that comes in that is having a stroke, and yes, we're able to give them the medicine and ship them on to a stroke center if the weather permits.
Fortunately, the sun was shining last year when Don Brown showed up at the ER with chest pains.
Within probably 3 hours, they airlifted me out of here to Oklahoma City.
Brown says he's seen Beaver go from having 4 doctors in 1980 to 1 now.
We need doctors in rural Oklahoma for old people like me.
The lack of doctors here in Beaver County can be an inconvenience. It can also be a real health risk. But that's the way it is in much of rural Oklahoma. In fact, in some places, it's even worse. According to the 2017 county health rankings, 2 Oklahoma counties, Grant and Greer, have 0 primary care physicians. Another 8 counties, including Beaver, have just 1, and 29 others have fewer than 10 doctors. Dr. Jack Beller serves on the Physician Manpower Training Commission. He says getting more doctors into rural Oklahoma is critical for the state's health.
It's estimated that about 40% of the people who live in those underserved areas are not getting their proper medical care.
At the same time, rural hospitals are struggling to keep their doors open. 94 of Oklahoma's 157 hospitals are considered rural, and as of last year, 42 were considered at risk of closing.
And it doesn't take, one more provider cut, the loss of a physician in the community if they retire or move away, that could take them from that, solid on solid ground to being off the cliff.
State leaders are well aware of these problems, but legislative efforts to find a cure have stalled. Of 5 bills introduced last session, just 1 passed, requiring that state-funded medical schools give Oklahoma students priority consideration when assigning clinical rotations. Hardly a game changer.
There's certain advantages to living here. And let me listen to your breathing.
Beaver's Dr. Matthews just hopes that more young physicians will see the upside to doctoring in a small community. He says it took him a while to see the light.
I really thought I was going to go into research. Just didn't turn out that way.
In Beaver, Oklahoma, Alex Cameron, News 9.
A little later in our special, our Lacey Lowry looks at how doctors in the metro are instantly reaching patients hours away.
And a new healthcare trend could keep you from waiting hours in an emergency room.
anything can walk in the door. We've had cardiac arrest here, we've had delivered babies.
Where micro-hospitals will soon take the burden off of busy Oklahoma hospitals.
Plus, how an Oklahoma man saved thousands of dollars on his medical bills with one phone call. And up next, the changes one sleepy town made that's giving residents a new lease on life. About 2 million Oklahomans live in rural areas and have little access to health care. Many are forced to drive hours to see a doctor or specialist. But our Lacey Lowry finds out health officials are thinking outside the box to bring care to rural Oklahoma.
Dr. Robert Rader prepares for a day of treating patients at St. Anthony's Hospital in downtown Oklahoma City. But the patients he sees are actually dozens of miles away.
How are you doing this morning?
I've been better.
At first there's an adjustment. Obviously, we're trained to be right there at the bedside and very hands-on. Describe the pain to me.
Through the hospital's telemedicine program, doctors see patients at 21 rural hospitals across the state, including Cordell Memorial in western Oklahoma.
You can look in the throat, look in the ears, and obviously the stethoscope is in some ways maybe even a little bit better than in person because I can adjust the volume.
Nurses at the hospitals wheel the doctors and the specialists into the exam room where they are able to evaluate, diagnose, and treat patients virtually.
The patients actually, I feel like, do better when they're cared for by the people who know them.
Telemedicine is the wave of the future for rural health care.
CEO Brandon Heiss relies on telemedicine to bridge the gap.
Patients love it, patients' families love it. They're not having to drive 2 hours to Oklahoma City.
But in small towns like Geary, there is no hospitals for the roughly 1,200 residents, so Oklahoma State University and Mercy have teamed up to bring this mobile clinic to Main Street once a week.
We are basically a clinic on wheels.
Inside the bus is a waiting area, lab, and an exam room. They also use telemedicine when patients need a specialist.
It makes my life a lot better.
Edna Sanders has macular degeneration and can't drive to her appointments.
This is really a help to me because it can let me get an appointment over with, and then my caregiver can take me back home and I'm fine.
It gives them a means to not travel, be uprooted from their homes, travel 3, 6, 8 hours away.
Which is why state officials believe these programs are a lifeline for rural Oklahoma.
If we can improve people, their health in the preventative side, we can catch things and help them monitor more closely or work on chronic diseases and help them improve their health before they become much larger issues and much more costly issues.
Lacey Lowry, News 9.
There's a statewide movement to get Oklahomans healthy. It's through a certification program which helps create healthier places to live, work, learn, and play. Our News 9's Lisa Monahan heads to a small town taking action.
Jones, Oklahoma, population 2,500, all the makings of a sleepy town. Quiet streets, a small downtown. But if you ask City Clerk Tammy Wallace, she'll tell you it's a town on the move.
We all need to be healthier.
She's taken the lead on getting her town on the right track.
It's changed the morale around here.
From balance ball office chairs to monthly wellness challenges like monitoring blood pressure. She has 100% participation in the program.
The first wellness check we did, one of our employees was a real bad diabetic who didn't know about it. So I feel like that saved a life there.
Runners ready. The lifestyle change has motivated employees off the clock too, where they line up for a 5K one weekend a month.
The health of our state isn't going to move without action.
The Oklahoma State Department of Health began the initiative in 2003 to recognize communities, schools, and businesses for making healthy choices. Jones has received the honor 3 years in a row. Some of the reasons include a strong tobacco ordinance banning smoking and vaping on city properties and a park with a walking trail. Plans are also in the works to expand the park to add exercise equipment.
It's really taken off. I never thought it would be what it is.
The town's healthy movement has also inspired schools and businesses to get certified.
We are so sedentary. All of us sit pretty much all day long.
Casualty Corporation of America worked with the town of Jones to become a certified healthy business. Now they have their own workout facility for its 35 employees and offer other incentive programs for participating.
It's dropped our call-in rate by almost 40% this year because people, when they feel better about themselves, they feel better about coming to work and they're healthier.
It's a recognition program. I think it helps people, get excited about wellness.
Lisa Monahan, News 9.
A mother says her son committed murder before he got the mental health treatment he desperately needed.
I hurt every waking minute. Every waking minute.
Still ahead, her mission to make sure the system doesn't fail any more families. And next, keeping Oklahoma children from falling through the cracks because of budget cuts.
More than 600,000 Oklahoma children rely on Sooner Care, the state's Medicaid. But budget cuts to the program could affect care for the state's youngest patients. News
9's Robin Marsh shows us how the program was a lifeline for one Oklahoma family.
Everybody she meets, she has to make them smile.
Behind those smiles, 4-year-old Lily is struggling inside.
Whenever she was born, we had no idea.
6 hours after their daughter was born, Jesse and Tiffany found out she only had half a heart.
Thought we were going to have a healthy baby.
Since then, Lily has had 4 open heart surgeries, and the medical problems did not end there. Last year, she was rushed to the hospital after suffering a stroke and cardiac arrest.
The scariest day of my life. Took a long time for me to cope with it. It would replay over and over in my mind.
While trying to keep their daughter healthy, the bills started to pile up. And then Jesse lost his job.
It was nerve-wracking, but I had a peace about it that everything was going to be all right.
Sooner Care offers really a bridge to health care during those times.
Sooner Care is Oklahoma's medical system and is managed by the Oklahoma Health Care Authority. The program pays for everything from medical and dental needs to hospital visits and medications.
We provide comprehensive medically necessary health care for these children.
In 2016, the state covered more than 1 million Oklahomans through Sooner Care, and more than half of those were children. The program has seen major budget cuts, losing more than $400 million since 2014. And for the 50,000 providers across the state, that means a more than 10% cut to their reimbursement rate.
We know that if your provider network erodes, it can impact your ability for timely care.
At this point, those past cuts have not affected access to care for the children who need it most, like Lily did.
It was nice. It was real nice when we had that and didn't have to worry about the finances of the health care.
Can I see your little finger?
Today, Lily still needs constant care through therapies and multiple checkups. And one day, a heart transplant.
She's a fighter. She smiles through everything.
Jesse got another job and admits the insurance is not as good as Sooner Care. But he says he's happy he's able to provide for his family once again.
I'll take any expense I need to for her. It doesn't matter to me. I'll pay it.
Robin Marsh, News 9.
A $30 million budget shortfall for the Department of Human Services means less money for Oklahomans who rely on home health care.
The right eye is completely blind. The left eye, the doctors are working on it, trying to save it.
Willa Baker uses the state's Advantage Medicaid waiver program for help with her medication, getting to doctor's appointments, cleaning her apartment, and it even pays for meal deliveries. But this latest round of cuts will mean $9 million less for a program Willa says she couldn't live without.
Without the program, I'm serious. I don't know what I would do.
DHS officials say they considered freezing the program altogether, but realized it would be too detrimental for many of their clients.
Like with most health outcomes, Oklahomans struggle with mental health, just as the state struggles to find adequate funding for mental health care. Tonight, Alex Cameron has a closer look at how serious the situation is.
Depression is a very dark place to go.
Francie Moss speaks from experience.
She didn't want to live.
Her daughter Heather, a mother herself, tried to commit suicide in 2013.
When you know your child is sick
and you're trying so hard to get to the bottom of it and to get them help. It is hell on earth.
Moss has been documenting that hell on earth, her daughter's bouts with drinking, joblessness, even homelessness, and one failed treatment after another.
When you don't have a job and you don't have insurance and you're depending on public services, state services,
the outlook isn't good. It's estimated between 700,000 and 950,000 Oklahomans struggle annually with mental illness and addiction. That's a quarter of the state's population. Of those who must turn to the state for help, there's only enough resources to help 1 in 3.
Oklahomans can't sustain any more cuts in the area of mental health and substance abuse services.
Lawmakers appropriated $328 million to the Department of Mental Health and Substance Abuse Services for this fiscal year. That's actually a slight increase over last year, but less than the $331 million department officials say they needed to maintain service levels, which they say had already been decimated by cuts the previous 2 years. Tens of thousands of Oklahomans, they say, who have been brave enough to try and get treatment for things like depression and addiction are now out of luck.
These are real medical conditions. When you leave them untreated, they get worse. And so what we're talking about, honestly, is life and death consequences often for people.
No one knows that better than Kathy Costello.
I hurt every waking minute. Every waking minute.
Now 2 years since her husband, Labor Commissioner Mark Costello, was stabbed to death in a Brahms parking lot by their mentally ill son, Christian, Kathy Costello knows things should have been different. Christian had been diagnosed with schizophrenia and needed intensive treatment, which even with the Costello's means, he didn't get.
He was in and out of St. Anthony's, the Crisis Center, Griffin, 5 times in an 11-week period, 8 months before he killed his father.
Costello says it's both tragic and ironic that it took committing a murder for her son to get the treatment he needs. The court ordered that he be sent to the state facility in Veneta, where she says he got good care and even came to realize what he'd done. Costello says while she's glad he's improving, it also makes her angry because it proves the system failed her family. But the anger fuels her advocacy. She's trying to educate Oklahomans, get them to understand that mental illness is a chemical imbalance in the brain and as treatable as any physical ailment.
People understand heart disease, Go Red for women, but they don't understand mental illness. So I don't think people fund things they don't understand.
And funding is critical right now, which is why advocates are also trying to convince lawmakers that funding more treatment will save them money in the long run.
The actual average cost to provide services is about $2,000 a year per person, and the consequences are much more expensive and much more devastating than that.
Francie Moss is trying to be optimistic, hopeful that message will get through.
There is hope. And I'm very blessed because I get to talk about my daughter and she's still alive.
In Oklahoma City, Alex Cameron, News 9.
Nearly 20 Oklahomans die every week because of painkiller addiction. How one man finally overcame an addiction that started in just the 8th grade. Plus,
I was terrified because I didn't know what diabetes was.
An unexpected diagnosis gives an Oklahoma teenager a new direction in life.
Oklahoma has one of the highest diabetes rates in the nation. In fact, nearly 100,000 Oklahomans have the disease and they don't even know it.
But through awareness and the Harold Hamm Diabetes Center, doctors hope to bring those numbers down.
Many people are out there with type 2 diabetes and don't know it.
Each day, 55 people in Oklahoma are diagnosed with type 2 diabetes, a rate that has quadrupled since 1994.
Now, how have you been doing since you were last here?
Dr. Hal Schofield says while heredity does play a role, a sedentary lifestyle and obesity are the main reasons for the increase.
You have to eat properly and have a good plan about how you're going to eat and lose some weight.
Bruce Sparling had a family history of diabetes, and even though he managed it for years with diet and exercise, he eventually had to use insulin.
I have to keep track of my carbohydrate intake, and that allows me to determine how much insulin I should take to match what I've eaten at a meal. So I've got all my portions as 54 grams of carbohydrates.
Then he checks the app on his phone to find out how much insulin to take.
So 6 goes into 54 9 times, so I'll take 9 units.
Diabetes is the patients out there at home in their regular life managing it day to day, meal to meal.
The Harold Ham Center in Oklahoma City helps patients manage their diabetes, while the researchers here work to find a cure.
We have physicians, diabetes educators, psychologists, physical therapists, try to bring everything to the patient in one spot.
Patients like Morgan Lane. She was 9 years old when she was diagnosed with type 1 diabetes.
I was terrified because I didn't know what diabetes was.
Type 1 diabetes is an emergency. It must be treated with insulin. There are no other treatments.
Type 1 diabetes is most common in children where the body does not produce insulin.
We haven't quite figured out about what triggers that immune system to malfunction.
Morgan is dependent on insulin and has a pump attached to her body that administers the hormone.
I think that's what made me mature a lot faster than most kids my age, because instead of just running around and doing what I want, I had to make sure that my body felt okay.
Type 1 diabetes right now is a lifelong diagnosis.
It's never held me back. I never let it.
Morgan's now in high school, managing her diabetes and living a normal life. She also brings awareness to the disease through lectures.
I'm starting to use diabetes more as a tool rather than a curse.
And the annual Walk for a Cure.
I just feel happy because I'm using my diabetes to help others.
If left untreated, it can cause serious health problems like blindness, heart attack, and stroke. Studies show you can lower your risk of type 2 diabetes by eating healthy plant fats like nuts, seeds, and vegetable oils. You should also limit how much animal fat and refined carbs you eat.
About 140 people die every day in our country from overdoses. You may be surprised to find out that's just from opioid use. Addiction to prescription drugs is now a national emergency. And here in Oklahoma, prescription pills are the leading cause of overdose deaths. Carl Torp is on the story.
You want to start the baking?
There's nothing mundane
Looking good.
about mornings with family for L.J. Clark.
It was almost done.
These moments are forever cherished, thanks to the dark days never forgotten.
I started buying them from a guy in school, and then it kind of just took off from there in the 8th grade.
The pills took a hold that Clark couldn't shake for more than a decade.
Kind of a sense of ease and comfort, like a warm sensation kind of just made me okay with everything that was going on.
What was going on was the birth of a son.
That relationship was pretty much non-existent for a long time.
Other relationships soon too fell victim to an insatiable opioid addiction.
Every morning that I woke up, that's all I thought about. My grandpa was dying on his deathbed, and he had hospice over at his house. And I went in there and I stole his whole prescription of Lortabs while he was dying.
Clark, too, though, was dying at a rate health experts know all too well.
Prescription drugs kill more Oklahomans than motor vehicle crashes.
That became the case in the past 7 years, according to the state health department. Opioids accounted for approximately 346 overdose deaths in Oklahoma in 2015, the latest numbers released.
So because these medications are FDA approved, they're prescribed by a physician, there's this assumption that they can be taken under any circumstance.
Avi Reedus with the health department says alternative therapies are now being pushed instead of pills.
Prescribing of opioids has gone down slightly, and we've seen a slight decrease in opioid-related deaths as well.
A task force to reduce opioid-related deaths was formed in 2012 in Oklahoma, and educating the public and providers like physicians became a priority.
Don't be an accidental dealer by allowing easy access to your medications.
She advises people to better secure any medications they have and warns how devious an addict can be.
Even if you're selling your home, it's not uncommon for people to steal medication out of your medicine cabinet while they're looking through your house.
Online, the Oklahoma Bureau of Narcotics shows you how you can safely get rid of excess medication at a drop box located at a number of law enforcement agencies.
It's a good reminder.
Meanwhile, L.J. Clark keeps his own mugshot on his phone. Around 30 times in and out of jail brought him to rehab.
I hurt the ones that were closest to me.
It took 6 times for sober to stick.
Yeah.
But Clark has been clean now for more than 2.5 years.
I feel better than I've ever felt.
Now those dark days serve as more than a memory, but also a father's first-hand lesson.
That's an experience that I'll get to share with him, and when he's ready, I'm free, and I haven't felt that way in a long time.
Carl Torp, News 9.
Whether you support Obamacare or want to see it repealed and replaced, there's no doubt insurance premiums are on the rise. What Oklahoma is doing about it next.
Plus, find out how one Oklahoman saved $8,000 on his medical bills, and you could too. Health insurance costs continue to rise for Oklahoma families. Last year, some saw their premiums double in price, with a nearly 10% increase again this year.
So what can be done? News 9's Dana Hurtnicki heads to the state insurance department to find out.
We've been calculating CPA Fred Immel's health insurance premium increases since 2015. The first year it went up from $1,100 a month to $1,700.
You know, that's a lot of money.
In 2016, he added up another hike.
$1,875 a month. And yeah, that's $22,500 a year.
This year, the increase is expected to be much more modest, closer to 8%.
But it's 8% on an already very high level that people can't afford.
Since Fred is self-employed, he buys individual insurance on the government exchange. That's where most people have seen the dramatic increases. Experts say it's because of ACA rules that insurance companies must insure you.
You're going to get a lot of people on your rolls that do have high-cost medical problems. And you have to offset that with a lot of younger, healthy people to come in, pay premiums to offset those costs. And we just haven't seen those younger, healthy people come onto those plans.
It's looking less and less likely that Congress will make changes to the Affordable Care Act before the end of the year. So the state is moving forward with a plan to institute what is called a 1330 waiver. It will create a high-risk pool that will offset the costs of individual members who have claims between $15,000 and $400,000 a year. The pool will be paid for mostly through federal government funds, but everyone in the state who has health insurance will also have to chip in. Right now, Combs says that's about $2.13 a month or $25 a year per person. He says that should stabilize not just the individual market, but health care throughout the state.
We're talking about fewer people in emergency rooms getting uncompensated care. We're talking about fewer people going untreated. And we think a lot of those costs trickle down through the rest of our society.
The hope is without insurers having to pay those high-risk claims, more companies will join the exchange and premiums will go back down to pre-2016 levels.
If Oklahoma can do something about it, well, that'd be great.
Fred hopes so, because for him, it would make health insurance affordable again.
The last 3 years has just been devastating.
Dana Hurtnicki, News 9.
You get sick or injured and you need immediate medical help. But what happens when you can't pay the hospital bills? It's the top reason for bankruptcy in America. But Craig Day shows us how you can bargain to lower those bills.
When his son Andrew was 13, Harry Layden faced a predicament. Andrew had to see a pediatric kidney stone specialist. Layden thought he was covered by a new insurance policy.
His surgery that he had to get happened a day before the health insurance would kick in, so he's not covered.
Layden ended up with a $7,000 hospital bill. He offered less.
I'm offering you $4,000 in cash. And of course, she said no, they couldn't do that. And I said, then I'm going to pay you $50 a month till it's paid off. And that's the best I can do.
The hospital ended up taking the lump sum payoff, saving Layden $3,000. Fast forward 6 years and Andrew got kidney stones again. Layden's insurance company had put a rider on the policy saying any future kidney issues for Andrew would not be covered.
Emergency room bill came to $7,000 for 3 hours. $7,000.
He offered $2,000 in cash and they took it, saving $5,000.
Layden says he's fortunate he had enough money on hand to be able to settle those medical debts for much less, saving thousands of dollars. But what if you don't have that kind of money in savings to settle your medical bills?
You have to think different about debt.
Chris Hogan is a financial expert who works on the team of nationally known radio host and financial expert Dave Ramsey. He says the worst thing to do is ignore the bill. If the debt collectors come calling, Hogan says you have to be proactive.
Let them know exactly where you are, what your situation is, and begin to communicate what you can do about it. Don't let them tell you what you have to pay. Pay what you can.
Hogan says call to check in each month. If you get any extra money, pay a little more. And a settlement? It's very important you get it in writing.
A lot of times they'll throw out things just talking with you to try to find out how much money can you get your hands on at this point in time. So slow down. If they won't put it in writing, it's not real.
In Harry Layden's case, negotiating worked out well, ending up seriously saving him money.
You just have to go and ask. You have to ask them, can we work out some kind of a deal?
Craig Day, News 9.
How urban clinics are helping Oklahomans on the go by bringing convenient medical care to where you live and work. Plus an app that can help you find quality health care that won't break the bank.
We all want easier access to our doctors, and we want the same when it comes to health insurance.
Now there's an app for that. Megan Farley finds out how the industry is tapping into the user-friendly mobile trend.
Matt Scoville was new to the world of healthcare and insurance and was just trying to find out how much a doctor would cost. He says it wasn't easy to get an answer.
I need to build an app that shows you how much it costs to go to the doctor.
And 4 years later, you have his company, Tulsa-based Medify. The mobile app allows patients to check quality and cost for things like doctors, clinics, hospitals, and procedures.
Because you don't know the cost of care ahead of time, there can be a 10 to 20x price difference in your own city. So in Tulsa, an MRI costs anywhere from $300 to $5,000 for the same MRI, depending on where you go.
And he says many in the marketplace right now are millennials and tech-comfortable baby boomers. Physician Steve Sanders says patients are also steadily making the switch over to MyChart. The web-based service started very basic, but has evolved. Now, patients and doctors can address everything from allergies to medications to immunizations to lab results, and it doesn't need to be face-to-face.
If you're 10 o'clock at night and a question comes up in your mind in terms of how you're taking a medication, you can send a message to MyChart and either it gets answered the next day or sometimes almost immediately, depending on when the physician is on the system.
But some things you still do, of course, need to see your doctor in person. But programs like MyChart can speed up the process.
Or chest pain's a red flag, right? So we can message that patient immediately, say, come into the office, we've got an opening today, let's get you evaluated. And it turns out that patient's having a heart attack and not acid indigestion.
So many agree this mobile trend is something we will be seeing more and more of in the healthcare industry.
They're starting to put the engagement back into the employer and the employee relationship to manage costs and deliver care in a technology-based way.
On the scene, on the story, Megan Farley, News 9.
The revitalization of Oklahoma City draws people downtown to work, play, and now live.
There's been so much growth that Integra saw an opportunity to bring healthcare to a thriving downtown with its urban clinic.
We're right here in the middle of downtown, so we're right here in the heart of everything. It's a lively feel whenever you walk in here. We have the exposed brick walls, we have the cool copper pipes that we left from Rothschild's department store. We have some really modern artwork throughout the entire clinic. There's so much growth happening here that we just wanted to be able to offer a clinic that was convenient for those people that live and work in this vicinity.
We have space for 3 physicians, there's 9 exam rooms. We want to take care of children, adults, the elderly, and really get the whole scope of medicine rather than just be in urgent care. It's steadily increasing in patient population and in number of visits I see every day. Thanks for coming to our clinic.
Since the clinic serves working professionals, early morning and lunchtime appointments are offered.
Every second counts when you're having a heart attack.
They took me in pretty quick.
The new way doctors are seeing patients and saving lives by bypassing the emergency room. You've heard the saying, some of the best things come in small packages, but does that apply to high-quality emergency care?
We traveled to Dallas to get a look at a micro-hospital, a big idea that will soon be in the Sooner State.
The ER, we're the safety net. You can have a ton of sick people coming in, a bus crash, a wreck, whatever. They're seeing huge numbers. They're often full. The ER waits are incredibly long.
Dr. James Nichols should know. He spent 20 years working in a hospital ER. Now he's found a change of pace inside this micro-hospital north of Dallas.
Micro-hospital is a relatively new model for healthcare delivery. It's everything a big hospital is, but obviously micro, more compact.
Micro hospitals range from 15,000 to 50,000 square feet with 8 to 10 ER treatment rooms and the same number of inpatient rooms. Like a traditional ER, it's open 24/7, includes a pharmacy, lab, and imaging services.
Anything can walk in the door. We've had cardiac arrest here, we've had delivered babies.
Micro hospitals are popping up in several states, including Texas and Colorado. And now Integris is bringing that trend to Oklahoma.
This is more of a retail type of an approach to medicine.
Integris president and CEO Bruce Lawrence plans to build 4 micro hospitals in the metro.
It's going to be close, convenient, and if it's truly, something that you can get in and out, you'll be able to do that very quickly.
Integris will build its first micro hospital in Moore. 3 others will follow in the west, southeast, and far northwest sections of Oklahoma City. These facilities will not compete with the larger hospitals, but instead take some of the burden off of them. That begs the question, are those places going to be swamped with these people who are actually non-emergency, who just want to go see a doctor?
That's what they're geared up for. And then they won't have the distraction of an ambulance coming through the door with a major automobile wreck or a major, heart attack that requires everyone's attention and resource.
Micro hospitals are typically built in suburban and urban areas, but still less than 20 miles away from a larger hospital in case a patient needs a higher level of care.
They took me in pretty quick.
Glenn Davison lives just a mile away from this facility in North Texas.
What happened was I had a lot of plaque in my artery, and it collapsed, and it just cut the blood supply off.
He was having a heart attack, and even though micro hospitals aren't equipped to care for the critically ill, doctors here stabilized him and transported him to a larger hospital.
To me, it was a lifesaver.
Patient costs for a micro hospital visit are higher than those at urgent care centers, but lower than traditional hospital costs.
Our state ranks very low nationally when it comes to the health of our citizens, but changing those statistics starts with each one of us.
Tomorrow night, we look at 3 simple things that will put you and your family on the road to better health.
A lot of times it just takes a lot of little steps to make really big changes.
And none of us can escape aging, but there's research going on right here in our state to keep us living better for longer.
If we can understand what's going on there and intervene to slow down that process of aging.
Plus, is your mood making you sick?
People who were more optimistic did better. Heart disease, cancer, pregnant women, pregnancy outcomes.
Those stories and much more tomorrow night at 8.
That's all the time we have for now. If you want more information on a story you saw tonight, check out the News 9 app.
Thanks so much for joining us, and we'll see you back here at 10 o'clock.
State of Health has been presented by Diagnostic Laboratory of Oklahoma. Choose to know through DLO.